Hello, and welcome to our presentation on blood flow restricted strength training. I am Dr. Abe. I have been running competitively ever since I was a child. Um, and I grew up loving physiology. My dad was a doctor. And so I decided that I wanted to pair these two great things together, and that's why I'm here today.
And I am Dr. Yasuda. I love physiology. I love understanding the processes that go on inside the body, the different things that happen, and also exercise. I have a big passion for exercising, and putting my body um, into very stressful circumstances, underweight, and combining the two just seemed like heaven.
Absolutely. And so today we wanted to talk briefly about some health benefits that are associated with exercise, like brain health, weight management, reduced risk of disease, strong bones and muscles, and your everyday activities will also be improved.
And so when we're looking at the why for this experiment, we're looking at modifying workouts to accommodate those who can't perform high intensity workouts. And we're looking at populations of older people, those who have heart problems, those who just can't get high intensity workouts anymore. We're looking for an effective way that they can still exercise and get the maximum muscle growth that they can and want.
And so our hypothesis is that the greatest muscle growth and strength improvements are associated with a concentric blood flow resistance in comparison to an eccentric blood flow resistance. And so to begin our methods, we found 10 healthy young men that had not previously been to a gym in over a year. They were all around in the weight range of 150 to 160. They were all about 5'6". And when we first begun our tests, we actually started off with some preliminary measurements. We needed to do some tests. And so we started off with an MRI test that was going to determine the muscle thickness of these 10 men. And then we also did a maximum voluntary isometric contraction test, where we had them sit down and we tested their isometric contraction strength. And we'll talk more about that in a second. But we also, in doing that, when we were doing that test, we had them do it 5 or 6 times before we went and tried to get their max. We did this so they could understand what it looked like, what it felt like, to kind of understand what they were really doing. And then we started the testing where we started them at what was their perceived 80% 1 rep max. From there, we increased it by increments of 5% until they can perform the bicep curl with proper form.
And so the training schedule looked a lot. We had a very strict schedule that we followed. We performed the exercise. We had them perform the exercise 3 times a week for 6 weeks. And it typically would look something like we would have them do 30 reps at 30% of their 1 rep max. That 1 rep max was measured at the beginning of the study. And so within those 75 reps, we had them perform 30 reps at that 30% of their 1 rep max. After which we had them perform 3 sets of 15 reps with 30 seconds of rest in between. So that's how we get the 75. We have the 30 and then the 3 sets of 15. And we had them do that at a cadence of 1.5 seconds for both concentric and eccentric.
And then the last thing that we did was, like my friend here was saying, that we had them choose one arm to do concentric resisted blood flow, and then we had them do one with eccentric. So one was concentric, the other one was eccentric. And so Again, we did our MRI testing pre and post, but we also did it post. We did it after because we needed to be able to determine their cross-sectional area and their muscle volume to see the overall growth from our study, along with an electromyograph and ultrasound, just to be able to determine the overall results of our subjects.
Mhm. And so when we're looking at blood flow restriction, we used the Keiatsu master blood flow restriction device. And this, we were using an armband. We had them wear on the most proximal part of their upper arm. And so on day one, we had the pressure set to 100 millimeters mercury. And each session, each workout session from then, we had an increase of 10 millimeters mercury. We topped out at 160. So once we started at 100, we increased to 110, 120, and so on until we hit 160, at which point we stopped. And the blood flow restriction was the same for concentric as well as eccentric. And I understand this was you this morning working out at the gym.
Yes, it was. And so our results from the ultrasound muscle thickness tests were, we had, as we can see from our graphs, that our individuals were around the range of about 2.65 on their mid upper arm on their muscle thickness. And then it increased substantially for our concentric blood flow resistance. As in comparison to our eccentric blood flow resistance, we saw that they were both around the same, but there wasn't as much growth. And this was immediately after every exercise. This was the immediate results after every single exercise. And we also did the same measurement, but a little bit above the elbow joint. And so the same results applied, and we could see that concentric blood flow resistance seemed to have an acute effect on the muscle growth.
And so when we were looking at the maximum voluntary isometric contraction that they could perform, we used a dynameter to measure this. And we can see that the MVC, when measured with the concentric of pre-study, was right around 38. When we finished the study, this is post-study here, the concentric MVC had grown substantially. It had reached just about 41 Newton meters. And so when we're looking at eccentric, we don't see the same correlation. They started just about the same, eccentric and concentric, but eccentric grew just a little bit, about little over half of what the concentric grew.
Yes. And along with that, the way that we did this is kind of like in this picture is depicting. We had them sit there with the dynamometer around their wrist, sitting at like a 90-degree. There was a 90-degree angle for their arm, and they were supposed to obviously work against the force that we applied to them. And so we had them again before the studies began and after all of our exercise sessions. We had them do MRI testing for their muscle thickness, and for their cross-sectional area. We had them do, well, based off of our graph, we were able to see that there was a larger percent change for our concentric blood flow resistance, again showing us that we had a greater growth with the concentric blood flow resistance in comparison to our eccentric, where it seems to have been a lot smaller. And our data is also showing us down here, this is just complementing this again, as the distance from the elbow joint, as we are moved farther away from the elbow joint, on this side of the axis, and moving closer towards it, we find that there's a more significant increase in comparison to the pre and post study. Um, so.
And so we also had them measure with an electromyography, an EMG. And the skin was shaved and prepared with alcohol wipes. And we saw that the skin had an impedance of less than 2 kilo ohms, so not much resistance. And so when we're looking at it, we see that the activation is greatest in the concentric. We see that that with each we measured each 5 reps was measured as 1 data point. So we have 5 reps here, we have 5 reps here, 5 reps here. So we have 5, 10, 15, and as it continues to go up, we see that concentric motion increased muscle activation every time. We don't see that as much with eccentric. We see a lot of just kind of gradual increase, if any. But even with second, third, and fourth sets, we all see muscle activation increase with the concentric rather than eccentric.
And so now for our discussion, blood flow resistance in combination with resistance training has the largest effect on acute increased muscle size. And you know what's also acute is that kid.
And so we see concentric exercise induces enhancement of muscle protein metabolism. And this could be the basis for the increase of muscle size. And so we saw a decrease in plasma volume. We saw an acute increase of muscle fiber cross-sectional area. And the cell swelling, we believe, was due to the osmotic water shifts into the cell due to increase in protein synthesis and decrease in proteolysis. And so that consumes water as that process takes place.
And so during our blood flow resistance exercise, muscle activation increased progressively only when concentric blood flow resistance exercise was performed. We saw, again, a rapid change or a rapid change in our equilibrium for our osmotic gradients. Constriction caused lower recycling of metabolic waste, which causes the accumulation of metabolites intracellularly. This changes the ICOP pressure gradient, resulting in a shift of equilibrium of the water.
And so our findings showed that concentric blood flow exercise increases the muscle activation. It could be one of the most important factors for the muscle hypertrophy following resistance training. And we found that there was a minimum exercise intensity of about 10% of the maximal strength. And that was found through our studies, through multiple other studies that we've read. And so therefore we can deduce that from our present study and from previous studies, that the magnitude of muscle activation as well as muscle cell swelling may not be large enough during eccentric contraction to induce the muscle hypertrophy needed to increase your muscle size and strength.
And so in conclusion, our results in the present study suggested that low intensity concentric blood flow resistance training may lead to pronounced muscle cell swelling, the response to which may be an important factor for promoting muscle hypertrophy.
And we like to have a special thanks to a couple of our students. They really helped us out in our lab.
Absolutely.
We have Mr. Cross Extensor over here on the left and Dr. Kimchi on the right. Without them, I don't know where we would be. They did a lot under our direction.